Alright, so we're looking at the concept of Rhesus factor incompatibility. So Rhesus factor, they usually just write it as what? RH. Let me give you guys a little gist. A woman married her husband. Her husband is Rhesus positive. That woman is Rhesus negative. Of course, negative and positive, they can't interact. Do you understand? So what happened was the woman had a baby. So as she had a baby, right, when she was trying to deliver, then her blood and the blood of the baby now mixed. All right, so your immune system, which is basically an immune system of a negative Rhesus factor, it will now attack the baby because the baby is Rhesus positive. Do you understand? Because these two things, they are incompatible. It's just like a foreign body, in the mother. Do you understand? So it's just a condition that can occur during pregnancy when the mother has Rhesus negative blood, right? So the mother is carrying a baby that is Rhesus positive. Now, this mismatch can lead to serious complications if not properly managed. Okay, so what is Rhesus factor in the first place? Rhesus factor is a protein, is found on your red blood cells. Do you understand? So if you have it, you are Rhesus positive. If you don't have it, you are automatically negative. So the mother doesn't have the protein on her red blood cell. So how can the red blood cells of the mother recognize the red blood cells of the baby? There will be an issue, So about 85% of people are, however, Rhesus positive. But you always do this test, as parents, just to pick up issues, So what causes this Rhesus factor incompatibility? So it can occur when a Rhesus negative mother is exposed to what? A Rhesus positive fetal blood, usually during labor or delivery, miscarriage or abortion, invasive procedures, if there's trauma to the abdomen. Okay, the mother's immune system may produce antibodies that will fight the Rhesus positive cells of the baby. You understand? Because the mother's immune system is thinking as if the baby is a disease. Do you understand? That's just how your immune system don't have eyes. Immune system will only allow what is like it, what is like the body of the owner. Anything that is outside the body of the owner that is looking different, your immune system will attack it. Okay, so what are the risks to the baby if the baby is attacked? Of course, the baby is vulnerable at this time. Okay, so sensitization occurs. Sensitization is like you are sensitizing me that okay, there's an enemy. Do you understand? So if the mother is sensitized, the immune system springs into action. Antibodies are produced, they cross the placenta, they attack the baby. All right, so it can cause hemolytic disease of fetus and newborn, also known as erythroblastosis fetalis. Like it will attack the red blood cells of the baby, break them down. Do you understand? So the baby can now be lacking red blood cells because a lot of it was broken down. There's jaundice. What is jaundice? The eyes should be yellow. Jaundice is usually there if you have plenty red blood cells being broken down, so they release bilirubin. It's the bilirubin that causes your eyes to be yellow. There's fetal hydrops. There's swelling, okay, stillbirth. Now you can give birth to a baby that is dying, So diagnosis and monitoring is blood tests, blood typing, and antibody screening early in pregnancy. So if the mother is Rhesus negative, paternal blood type may be tested, antibody titers monitored if sensitized, ultrasound, Doppler studies just to check if the baby is having issues, amniocentesis, or fetal blood sampling in severe cases. So prevention is they can actually give a drug known as RH immunoglobulin, all right, So you give it around 28 weeks of pregnancy, and within 72 hours after delivery if the baby is positive. Okay, so after any event where the fetal blood might mix with the maternal blood, can still give it. So if the fetus is affected, intrauterine transfusions may be needed because the baby will be anemic. Early delivery might be considered in severe cases. So that's just what rhesus factor incompatibility simply means.